Welcome, sir. I am delighted to welcome our controller, Professor Dr. Anil Kumar, sir, Dean Research Professor Dr. A. Shaji, sir, Dean Student Affairs Dr. Iqbal, sir, this program. Hearty welcome to all of you, sirs. My sincere and hearty welcome to all the distinguished participants to this webinar. I, on behalf of both the centers and Kerala University of Health Sciences, extend our warm welcome to each one of you. Welcome all. Next, I would like to invite our Honorable Vice Chancellor, Professor Dr. Mohanan Kundumal, sir, to inaugurate the program and deliver the inaugural address. Sir, please.
Good evening. Invited faculty of today's webinar, Dr. Arun Kishore, internationally renowned Professor of Psychiatry from UK, my colleague, Pro Vice Chancellor, Dr. C.P. Vijayan, Dean of Research, Professor K.S. Shaji, the organizers of this meeting, Dr. Sandhya, Dr. Anoop, former Pro Vice Chancellor, Dr. Nalilakshan, Dr. Madhavan, my great friend and great psychiatrist, respected faculty members, respected invited guests, my dear students, and ladies and gentlemen. Kerala University of Health Sciences is extremely happy to conduct a webinar on this very important topic of work, stress, and well-being. And this topic is all the more important today as we are going through the second wave of the pandemic, COVID pandemic. And health professionals have been called as the frontline warriors all over the world. Doctors, nurses, and all other allied health professionals were facing this unprecedented stress. Health professionals is a very stressful profession. Health profession is a very stressful profession, and we are asked to relieve the stress of other people also. So who will take care of our stress? That's a very interesting topic. And this pandemic has created a big problem for the university. Our teaching stopped. Almost 1 year, we could not do the conventional teaching. But then we went on to online teaching, which none of our teachers knew how to do it. None of our students knew how to do it. Maybe they knew it little better because they were handling the mobiles and laptops much better. But the teachers did not know anything. And then they tried to teach them. And the university believed that they were successful. And we believed that students understood also. But the whole thing created a tremendous amount of stress among the teachers, among the students. And now we are facing the examinations. And now we realize that some of the students have appreciated it very well, and they got a distinction in the examination. And in certain colleges, students have miserably failed. So we cannot say students have failed, the university has failed. So all these things have created a lot of stress to the students, faculty, and eventually, finally, it comes to the Vice Chancellor also. I'm also facing the stress. So to discuss all these things, we have a very eminent faculty, Professor Arun Kishore. I'm so happy to say that he was my colleague many years ago in Thrissur Medical College, and he is here. So I welcome Arun among us, and with these few words, I declare that this webinar is inaugurated. Thank you.
Thank you, sir. Thank you for your incredible and motivating words, sir. Next, I would like to invite our Pro Vice Chancellor, Professor Dr. C.P. Vijayan, sir, to felicitate the gathering. Sir, please.
Vijayan, you are muted. Vijayan, you are muted. Please unmute.
Unmute. Ah, yes,
Yeah,
yes. Okay.
That is one stress.
Yes. Yes. Honorable Vice Chancellor of Kerala University of Health Sciences, Professor K. Mohanan. Dean Research, Dr. K. Shaji. Dr. Anup and Dr. Sandhya, hosts of the meeting. Other officers of the Kerala University of Health Sciences. Today's distinguished speaker, Dr. N.R. Arun Kishore, faculty, students, and guests. Our honorable previous PVC, Dr. Nalinakshan. Yes, as our honorable VC mentioned, yes, all of us are having stress in the workplace, and also for the students because of the examinations and so many other social problems. So we have to cope up with this, and there are scientific methods to get relieved of this stress and strain, and to achieve well-being. And we are going to hear from a very eminent speaker, Professor Dr. N.R. Arun Kishore. And I am also very happy that I also had an opportunity to work along with him way back in 1984 in Trichur Medical College. Yes. At that time, Dr. N.R. Arun Kishore was tutor in medicine at that time, along with our Ashwin Kumar sir and all. Probably he is remembering those old days. Okay, I'm not wasting time. I am offering. I am very happy to be part of this program, and I wish all success for this program and also our future endeavors to get relieved of work stress and to achieve well-being. Thank you. Thank you very much.
Thank you, sir, for your inspiring and encouraging words, sir. Now I invite Dr. Sandhya to introduce Professor Dr. Shaji, sir, who is the chair of the session.
Thank you, Dr. Anu. I take this great privilege to introduce our chair of today's session, Professor Dr. Shaji, sir. It gives me immense pleasure in introducing our Shaji, sir. Shaji, sir is presently the Dean Research, Kerala University of Health Sciences. Sir did his MBBS at TDMC at Alleppey and MD at CMC Vellore. Sir with the faculty at CMC Vellore till 1991 when he joined GMC Thrissur. And before now he is a retired professor of psychiatry at Government Medical College Thrissur. Sir's area of interest include geriatric mental health, especially on dementia. Sir has published several research articles on high impact factor journals, both in national as well as international journals. And Sir has received awards like ICMR and National Academy of Medical Sciences for his work in geriatrics. With this brief introduction, I humbly request Shaji sir to kindly chair the session of Dr. Arun Kishore, sir. Thank you, sir.
Honorable Vice Chancellor, Pro Vice Chancellor, officers of the university, and our guest speaker, Dr. Arun Kishore. It's a pleasure to chair this session, which is going to, Dr. Arun Kishore is going to present to us a very important topic, that is work, stress, and well-being. As was highlighted by the Honorable Vice Chancellor, this is a time when we need to reflect and take stock and see how we can actually move forward, handling ourselves better, our work output better, and how we can move together in a very challenging time like this. I have great pleasure in introducing Professor Arun Kishore. Can you hear me now? Anu?
Yeah, you are very much audible, very much audible.
Okay, thank you. Dr. N.R. Arun Kishore was, as was mentioned by the Vice Chancellor and Pro-Vice Chancellor, he was our former colleague. He did his MBBS in Calicut Medical College. I recall meeting him for the first time during intermedicos at Calicut. And then later on, the intermedicos at Alleppey Medical College when I was final year. He did his MD from NIMHANS, then did his DIPNB National Board, then joined Thrissur Medical College, I think towards the end of '89, and was there till 2005 when he left for UK. He pursued specialist training in general adult psychiatry under Royal College of Psychiatrists, UK, then did his MA in clinical education. His basic interest, he was the best teacher Thrissur Medical College ever had. He had a huge student fans, and then he actually encouraged many people to take up psychiatry. He had finished a diploma in group analysis and a diploma in reflective practice from Institute of Group Analysis in the UK. He is a valiant leader. He will, I think, during the course of his talk, he will tell us more about valiant groups, how valiant group can be a supportive, a support for professionals in general. He at the moment is a consultant psychiatrist in Sussex at National Health Foundation, UK, and also a clinical professor of psychiatry with American University of the Caribbean, and also fellow of the Academy of Medical Educators, UK. He was also very active. I recall in the 90s, he started an association for learning disability India, and that was greatly appreciated by the district administration and the state government. He, in fact, was instrumental in getting learning disability as a major issue by the government of Kerala. And I'm sure he will now talk to us and give us some guidance or ideas regarding how, as a university, how Kerala University of Health Sciences would develop strategies to support trainees and faculties who are engaged in healthcare education. And so I have great pleasure in welcoming Dr. Arun Kishore, and I, on behalf of all of you who are eager to listen to him, request him to take over and start the presentation. We will request all of you to kindly note down and ask questions on the chat box. If we have enough time, we will open up discussion also. Anu, do you want, or Sandhya, do you want to say anything before Professor Arun takes over? Is there any announcement which you want to make?
Sir, we just wanted all the participants to kindly mute their audio, as well as they can, if they have any questions to be asked, they can post it in the chat box. And if they want to directly ask the resource person at the end, maybe we can give some, we'll unmute them so that they can have the direct interaction if they are interested. This is the announcement we would like to make, sir.
Over to you, Dr. Arun Kishore, and we look forward you to be in touch and help the university in various ways which you can in the future. Over to you, Arun.
Thank you. Thank you all. And it's such a pleasure to be here amongst friends, colleagues, Dr. Vijayan, Dr. Mohan, Shaji, and also amongst teachers. I saw Dr. Krishnan here earlier. And it is my honor to be actually speaking to such a large and august audience today. And so I hope that I might be able to pass on some of my understanding about stress. Let me start sharing my screen so that you can see my slides. A question that sort of arose in me is what sort of understanding do I have to actually be speaking about stress? And in answer to that, I'd just like to add to something that Shaji said, which is that I'm also, in addition to some of what Shaji said very kindly about me, I also, for the last year and a half to 2 years, I work with an organization called Practitioner Health. And it is an NHS, National Health Service organization, devoted to the care of doctors and stress in doctors. So my topic is actually work stress and well-being. What I'd like to say is my focus will be on stress and doctors, actually. And the focus of my talk will be about where do we locate the disturbance when we talk about stress in doctors. You'll understand the reason why I would like to focus on that. What I'd also like to say is that my focus will not be on individuals and their management of stress. It will be more upon what systems can do, for example, what the university or what a department could do when doctors are stressed. So when I asked myself these questions, these 5 aspects came to my mind. So I'll introduce a topic, and then I'll ask, are doctors stressed? And I'll also ask, are doctors differently stressed? So what is different about stress in doctors? And then I'd like to ask about and look at what interventions work with this. And finally, I'd like to come back to this issue about where do we locate the disturbance. And I'll talk about that for a little bit because it is a political question, actually. So to define our terms, now stress, as we know, is the adverse reaction that people have in response to excessive pressure on themselves. So it is a self-report. So what I'd like us to understand is that stress is something that is perceived by the individual. It's not something that is diagnosed by somebody else. It is what is perceived by me. So it is a very personal issue, and it is rated by me on a scale. In comparison to stress, there's the other term called burnout, which is very commonly known. It is a much more serious reaction, which has 3 components, actually. So there's emotional exhaustion, there's depersonalization, and there's reduced personal accomplishment. And both of these, stress or perceived stress and burnout, can be measured by various tools. The common understanding of stress is that it is depression, anxiety, or substance misuse, or maybe errors that doctors make, or difficulties in retaining doctors at work. Let us understand that those are the outcomes of stress. They're not stress by itself. And there is a distinction here to be made because stress is not a disease. In comparison to these 2 terms of stress and about the burnout, we have well-being, which is a different term. Now, physician wellness has come up much more recently in the 2000s, where the focus has moved from measuring stress into talking about physician well-being. And there's a reason for this. Now, well-being is defined as a quality of life, and it is the absence of ill-being. The more perceptive amongst you will notice that this is the WHO definition of health, actually. There's a reason to start talking about well-being, because if you take the focus away from stress being a disease and you talk about well-being, it makes it much more acceptable. It takes away the stigma as well, and that's important. So we now have certain dichotomies. We have stress versus well-being. We have the individual versus the system, and we have the personal versus the professional. And I'll talk about the personal and the professional a little bit more as we go on. And I'd like you to remember these dichotomies, because it is based on these dichotomies that we will guide ourselves as to the management or the systemic management of stress. I'd like all of you to take a look at this particular slide and to think about where would you place yourself in this hierarchy. For example, would you say that you have today, as a professional doctor, you have access to food, time to eat, enough sleep, and that you're not depressed or anxious or suicidal? If you are, then can you also say this, that your job is secure, that your future is predictable, that you are safe, and that your patients are safe? And if you can say that, can you also say that you are respected and included, that you're not hassled by IT or by bureaucracy, that your family time is respected? Can you also say that you are noticed and appreciated, that you are connected and compensated for your efforts? Can you say that you have time, autonomy, and resource to think and to heal patients? Where would you place yourself in this hierarchy? And there's a reason to say this, because this is the wellness hierarchy as defined by Shapiro. So you now understand that we are not just talking about removal of stress, we are actually talking about well-being. And it's important to try and see how we can achieve this. Now, back in about 108 years back, Yerkes and Dodson did this experiment and they came up with this curve. What this curve represents is, on this axis, we have the performance. On the x-axis, we have the performance. And on this axis, we have arousal or stress. And what you might see is that as stress increases, performance increases, and then it reaches a peak. And at optimal arousal and optimal performance, any stress beyond that, performance decreases. It's important to remember this. Now, this is not a perfect curve. It can take various shapes. But the lesson that we get from this, and it's still valid because it's almost become a law now. It's moved from becoming a curve. What this shows is that you need optimal stress, but you don't need too much of it. And the trick, or perhaps the management of stress, is based upon keeping the stress at this particular level. And let's see how we could do that. So we're not talking about a certain myths here, and I'd like to remove that. The first is that stress is not a disease. And you're not weak if you're stressed. If you're not stressed, I'd say there's something unusual about you, especially if you're at work. And that stress management is not down to the individual. It is actually a systemic problem. So we could sort of put stress and wellness on a sort of a continuum like this, where wellness is at one end, you have mild, moderate, and severe stress. And then as that increases, you have burnout and disease. Now, studies done in India, there are more than 19 studies actually, but these are the robust ones that have been reviewed. 4 editions of these have been done in Kerala. 2 of these studies are on well-being. Unfortunately, there are no studies on interventions to address stress in doctors. And the studies measure burnout and not stress. And so there's a high heterogeneity rate, and hence you can't compare these studies actually. But a systemic review which was done recently showed that about 24% of doctors are high on emotional exhaustion, 27% on depersonalization, and 23% scored low on personal satisfaction. These are all the criteria for a burnout. You might be surprised to sort of understand that 1/4 of doctors are stressed. And I'd say this is an underscoring. Because if you look at the rates across the world, in the UK, for example, 67% of the doctors here say that they're stressed. And I'm sure this is not just in COVID times, which means that there's a particular reason for doctors in India to underscore themselves. And let's take a look at why that might be. So the question that's often asked is, why talk about doctors' stress? Isn't the whole world stressed? Aren't all professionals stressed? There are particular reasons to talk about doctor stress. And one of these is perhaps this data from Australia, which might be comparable across the world, where they compared stress in doctors, that's males and females, and they compared it to the stress levels in the Australian population, and they compared it to other professionals. And you might see just on a visual scale that there is a major difference between these. So I suggest that doctors are more stressed as compared to other professionals. That's one reason. The second reason to focus on doctors, we're not just being selfish, is because the outcome of increased stress in doctors is actually problems in patients. So safer doctors equals safer patients. And that's the reason why we need to be addressing stress in doctors. I'd like all of you to take a minute or a minute and a half to rate yourself on the scale. If you have a pen and a paper, please try and write down your scores on this. What I'd like you to do is to read each one of these questions, and I'll read them out to you. It'll just take a minute. I'd like you to rate yourself on whether you score this as being very often, sometimes, not at all, or least. So ask yourself, in the last month, how often have you been upset because of something that happened unexpectedly? Do you score yourself on one of these? In the last month, how often have you felt that you were unable to control the important things in your life? In the last month, how often have you felt nervous and stressed? In the last month, how often have you felt confident about your ability to handle your personal problems? In the last month, how often have you felt that things were going your way? In the last month, how often have you felt that you could not cope with all of the things you had to do? In the last month, how often have you been able to control irritations in your life? And in the last month, how often have you felt that you were on top of things? And in the last month, how often have you been angered because of things that were out of your control? And in the last month, how often have you felt the difficulties were piling up so high that you could not overcome them? Now, what I'd like you to do is to rate yourself there, and on questions number 4, 5, 7, and 8, reverse the scores that you've got. So if you scored yourself 0, give yourself a score of 4. And I'd like you to total it up now. If you total it up and you came up with a score of less than 13, you're just mildly stressed. If you gave yourself a score above 13 and somewhere into the 20s, you definitely are moderately stressed. And any score above 27 is severe stress. My guess is that at least 1/4 of you would have scored yourself as being moderately stressed. Now, these are the scores that are accepted. So you might see that 0 to 13 is the average score on this PSS, or the perceived stress scale that you just answered. The higher the age, the less the stress. The higher the education, the less the stress. And of course, with increased income, your stress becomes less. And this is work stress across the US. My guess also is that most of you would have underscored yourselves. And there's a reason for that. As I said, the stress scores that we've seen in doctors in India is about 1/4 of them are stressed, but the scores across the world are about 67%. My reading is that there's a certain type of blindness that's happening here. Now, all of you would know that we are not very good at perceiving our blood sugar levels. In fact, people who are diabetic have what is called hypoglycemic blindness. And a lot of them don't recognize that they are hypoglycemic. Similarly, a lot of us don't recognize if we are hungry. And there's a word for it, it's called hangry. So if you're feeling angry, irritable, and you're in casualty, remember that you may just be hungry. So there might be a certain type of blindness. And most of you would be familiar with this particular four quadrant way of looking. It's called Johari's window. And there are some things which we don't know about ourselves, which is called the blind spot. And I suggest that stress blindness is a sort of a blind spot, especially for doctors. Let's ask ourselves why. Now, if you look at doctors and if you ask them, and this is a study done in the UK, if you ask doctors, if you had a mental disorder, let's consider stress to be a mental disorder for a minute now. If you had a mental disorder, would you divulge it? And 74% of them said yes. And then they went back to see how many of them actually did divulge it. About 40% of them did. And so what that means is there is a sense of embarrassment. There is a certain barrier between doctors being stressed and actually disclosing stress. That might be one of the reasons for the blindness. There are other reasons for the blindness as well. There is a sense of embarrassment sometimes. The embarrassment comes from various reasons. It's important to remember this because if we are to introduce any form of management for doctor stress, we would need to address the barriers to stress. So let's look at what are the reasons why doctors do not disclose or underrate themselves. Now, what we know is that presenteeism is a common symptom amongst doctors. They continue to work despite high levels of stress. 74% in a study done amongst doctors in emergency medical services, 74% of them would not take a day off, even if they were stressed. There's also a stigma attached to being labeled unwell. So most people feel that if you're stressed, you're unwell, and you don't want to disclose it. What could be the reason for this? Let me ask all of you, if you were asked to introduce yourself in a public forum, or if you were asked to introduce yourself amongst a group of amongst a group of people you know very well, how would you introduce yourself? My guess is that all of us would call ourselves, I am Dr. So-and-so. You would not say, I'm Arun Kishore. I would say, I'm Dr. Arun Kishore. There's a reason for this. There's a pride in being a doctor, but it also means that myself, my personal self, is a part of my doctor self. The two are merged. So we have a professional self, the doctor self, and with our training, that doctor self becomes a part of our personal self. And as a doctor, if your persona is a part of that professional self, when you become unwell, when you become a patient, or when you become stressed, there's almost a separation between the two. And that ambivalence is very difficult for doctors to bear. And hence, there's a failure to identify stress. All of you would remember that there are corridor consultations that go on. And corridor consultations are, you have somebody stop you in the corridor to ask, I have this small problem. What should I do? What do we do as doctors? We tend to try and reassure our colleagues when they come for corridor consultations. We feel slightly embarrassed by the doctor who asks us for help. And that becomes another reason for doctors not to seek help. They also know the system, so they know what the system can do for them. They also feel embarrassed about taking up another doctor's time, so they don't ask them. They feel embarrassed about asking another doctor because they feel, I as a doctor should know what to do in this particular condition, especially around stress. So all of these are the reasons why doctors don't seek help. And this is not unique to doctors. It's unique to a lot of professions. But the consequences of doctors' presenteeism are serious. They are on patients, and hence we need to address that. So I'd like to sort of bring about the slogan, if I can call it, accept support and help another. And how well can we do this? Now, let's now ask this question, are doctors differently stressed? Is there something special about the stress in doctors? This is data from the UK, where they looked at stress, depression, and anxiety in all workers in Great Britain. What they found was that 44% of this is due to workload. And the rest of the 70%, which is 13 and 14%, the rest of it is due to interpersonal relationship problems. What I would like to propose is that the stress that doctors face, the reasons for it, lie in workload and in interpersonal relationship problems. And I'd like to show you some evidence for this. Now, remember that by workload, I mean perceived workload. It's not actual workload. It's not the number of patients you see, but it depends upon how you perceive, how stressed you feel when you're working. Now, Sandeep Grover, who's a psychiatrist in PGI Chandigarh, he conducted a study on stress burnout amongst the staff, the faculty of PGI Chandigarh, and the residents there. So he came up with certain reasons, and he came up with a good score. He came up with a good paper, which is very well quoted now. I've taken some of the data of the questions that he asked doctors as to why are you stressed, and I've put that into a form of a graph. So what he asked doctors was the reasons why you're stressed. He asked them, is it because of issuing wrong prescriptions sometimes? A lot of them rated this as never, once, 2 to 5 times, or more than 5 times. And you can see the scores here. You can see that there are times when they perceive themselves as having lapsed in patient care. You'll see that they had problems with the carers of patients. They shouted at them. They felt that they had insufficient time for their patients. And they also felt that they had poor communication skills. And these are the problems that they've stated for their stress. So misses, time stress, and what I call moral injury. What moral injury actually means is that you feel helpless in a situation where you hope that if things had been different, you could have had a better outcome. And you feel morally injured because of that. And I suggest that doctors have this moral injury most of the time. Now, how do we rate time stress? Brad Berg came up with this lovely little way of codifying, of understanding time stress. So when I say that the doctors are time stressed, perhaps we could try and place ourselves somewhere in this circle. So if you ask yourself these questions and you rate yourself on a visual analog scale from 0 to 10, then if you can put yourself somewhere on a point here, ask yourself, do you have time for breakfast? Where would you place yourself here? Are you often late to work? Do you skip lunch? Do you do too much? And you ask yourself all these questions and you rate yourself on a scale from 0 to 10, you'll come up with what's called a stress flower. It's a visual analog of the time stress that you might face. And I suggest that most of us should try and do this. In Grover's study, the second issue that he came up with was interpersonal relationship issues. So he asked residents and faculty, do seniors lack empathy to the patient? Do seniors lack empathy to you? Do seniors lack empathy to a particular resident? And do seniors have a negative bias towards you? And these are the scores that they came up with. So my suggestion is that the reasons for stress in doctors is one, time stress. And the second is relationship issues. And that's not surprising. Don't be surprised that this happens to doctors. That's because we work in a team. And in teams, there is always stress. The question is, how can we address the stress? Now, Brad Berg came up with this lovely little stress flower for relationships similarly. And you can rate yourself on this flower. Questions are your issues fighting and conflict at home, or problems with the boss, problems with co-workers, bullying? I'd like all of us to try and rate ourselves somewhere on a scale of 0 to 10 on each one of these questions. And we can come up with scores and a lovely stress flower there. A third reason why doctors are differently stressed is what I might suggest is compassion fatigue. Now, how many of us have actually had a hard day at work seeing maybe 50 patients or 60 patients? How many of us have then gone back home and gone on a visit somewhere where there's a friendly uncle who asks you, oh, you're a pediatrician. I'd like to ask you a small question about my child. Or are you a psychiatrist or a psychologist? I'd like to ask you a small question about myself. And your heart starts to sink. That is a sign of compassion fatigue. How much of compassion can we have? How full is your compassion bucket? I'd like to ask. Many years ago, Shaji and I used to go to the South Indian Bank in Thrissur, and we were asked to come there and lecture to the staff there on stress management. We did that. I think we did it several times in a year. And then we came back to Thrissur Medical College. At that point of time, both of us had a form of stress blindness because we never thought about the stress that we might have ourselves or the stress that our colleagues might be undergoing. And that, I suggest, is a form of stress blindness. It might be because of compassion fatigue as well. To balance compassion fatigue, we need what's called resilience. Now, what is resilience? This is the UK GP's perception of resilience. They say that resilience is personal characteristics, such as self-worth. How worthy do you feel of yourself? What's your self-esteem? How flexible are you? What are your organizational skills? How assertive are you? And do you have humor? And now this is not just personal characteristics, it's also professional and organizational promoters. Do you have a strong management support at work? What is your teamwork like? Is it good? What are your workplace buffers and your resources? Now, if you have all of these, then you have good resilience. Resilience is the quality or the ability to bounce back when you're under stress. It's like a rubber ball bouncing back. Now, what we might need to do is not just address stress and burnout or compassion fatigue, we also need to try and improve resilience in doctors and training especially. Now, I've covered, I think, the first bit, and I'd like to spend the next 10 or 12 minutes talking about interventions. And I think this is the key. This is the major part of my talk. What interventions could we have for doctors' stress, especially? Now, I know that there are a few other professionals on this call, on the Zoom. So when I say doctors, please understand that I also include all other professionals who are here: psychologists, nurses, other carers, the people who help us otherwise, admin staff, all professionals. Now, the questions that we need to ask in stress management is stress management down to the individual? Do we leave it to individual doctors to manage their own stress, to recognize it? The second question is stress management the job of psychiatrists? And I'd like to say, with a great degree of respect, no, it isn't. It is every doctor's task. The third question is, are crisis call centers what are needed? And I ask this question because the natural response to a doctor's suicide has been to set up crisis call centers. No doubt they're very useful. But is that all we need to do? Is a question I'd like to ask. The fourth question I'd like to ask is, we have specialty clinics to support doctors. Are these useful? And the last question is, where in this will we locate the support that we give doctors? Would we locate it after the problem has occurred, where there's burnout and disease such as depression or anxiety or substance misuse? Or would we place it somewhere where we can prevent it from becoming too severe, when doctors are mildly or moderately stressed? Would we also look at trying to improve the wellness of doctors? Because you have a highly motivated, highly intelligent population here, and they can contribute. They can only contribute if they are well. And I would suggest that the aim should be wellness, but we need to address it somewhere here. So the question that I'm asking is, where do we locate the disturbance? Do we address stress or do we address well-being? Do we ask the individual to manage their stress, or should we ask the system, for example, the university or a department or a surgical team or the psychiatry department, to actually look at the stress that might occur in doctors and in other staff? Now, Shapiro has classified the interventions that are available for supporting doctors and other professionals. The interventions can be classified into the primary, the secondary, and the tertiary. What the primary methods means is that it addresses the system. So this is a preventive measure, actually. it removes the source of work-related stress. So there are primary interventions that we need to talk about. And literature says, most of the research shows that these are the most effective. There are secondary interventions. Secondary interventions address the individual. They're partly preventive, they're also partly as a part of treatment. What they do is to improve the ability of doctors to cope with or reverse the effects of ill health caused by stress. And then there's the tertiary interventions, which focus on individuals and on the treatment of stress, depression, anxiety, or addiction. So let's try and see what these are. These are the tertiary interventions. And I'd like to say that the IMA Doctors for Doctors, a wonderful organization, they've come up with several strategies to try and address tertiary interventions for stress. For example, in Cochin, the IMA started a call center, and this is a paper by Sanju George and Valsraj Menon on the establishment and short-term evaluation of a specialist confidential service for doctors with mental health difficulties in India. This was set up in Cochin. It was actually a call helpline which was sent up, and they've come up with an evaluation. They had lots of people call in initially, but I'm given to understand, and I stand corrected here, that the number of calls has come down. So Sanju George again asked, if that isn't what we need, then do we need specialist treatment services for doctors with mental health problems? So he's talking about trying to address mental health disorders in doctors. An organization that I work for, which is Practitioner Health, was set up in the UK back in 2010, and it has been functioning. Now, this is funded by the National Health Service, so the government funds it. It is run by general practitioners, and it is essentially for doctors. It is a self-referral system. So any doctor who's stressed can refer themselves into this service. The service is run all over the UK. So this is a map of the UK, and you can see that there are several centers where there are practitioners like myself. And this is confidential. It is, we don't report a doctor who comes to us. We don't share that communication with anybody, even with the regulators, even with the GMC, the General Medical Council. We don't share that information with them. It is confidential. The number of patients who came increased proportionally. And at the moment, I think we have a huge number of doctors who come to us. What do they come to us with? Initially, we had doctors who came to us who were referred to the General Medical Council because they had problems with their practice. So the regulators sent the patients to us. And then we had a group of doctors who had substance misuse problems. And the third group of doctors that came to us initially were the ones who had mental health issues. But as the years progressed, as people came to know about the service, the sort of people that I see are, for example, a senior GP, a general practitioner, who's in a practice and he's having problems with his other partners. And so both the partners refer themselves to us. I see professors or I see faculty who are having problems with their trainees, with their students. And the trainee refers themselves to us, and the professor or the faculty refers themselves to us, because they're both puzzled about what's going on in this particular relationship. I have doctors come to us who have problems because they've just finished their training and they've become consultants now, and they're facing problems about managing time and managing relationships. So doctors come to us with various types of problems in this service. Now, who can actually become a doctor of doctors? The doctor of doctors is actually, do they need to be a psychiatrist? Now, most of the mental health, most of the professionals in practitioner health are actually GPs, general practitioners, but they need a slightly different sort of skill. They need a basic knowledge and understanding of human behavior, an understanding of counseling, things like negotiation skills, conflict resolution, crisis management, and a knowledge of local support services. They need an attitude to listen without being judgmental, the ability to hold without the need to suggest or to give advice. They need to be able to be available when they're needed according to the need of the doctor and not to be overwhelmed by the knowledge. And these doctors, all of us, are supported ourselves by supervision. So what I'd like to say is, if we are planning to set up a system of doctors for doctors, then those doctors need support themselves, they need regular supervision, and they need a bit of training as well. Now, having set up the PHP, the practitioner health, you would have thought that most doctors would self-refer themselves to PHP. This is a bit of research done by the British Medical Association, who asked all the doctors in the UK, do you know of any services that provide support to doctors who have physical or mental health problems? And 33% of them said, I don't know. 18% said, no. Only half of the doctors were aware that there was such a service. So the question here is, if we are setting up a system for to support doctors and other professionals, it needs to be popularized, it needs to be advertised, it needs to be made available. So I've spoken about tertiary interventions. Let me come down to secondary interventions. Now, what I said, secondary interventions are those that people who are stressed can learn. It's a form of self-help, actually. Self-help can come in the form of stress management, dealing with death, suicide, death in a patient is a major stress for doctors. Time management, for example, managing conflict, negotiation skills, or short sessions of cognitive behavior therapy, which somebody can apply to themselves. Mindfulness training helps. And I'd like to also come down to this issue of reflective practice groups or balance groups. Now, all of these are individual things which doctors can read up about and help themselves. They don't need a therapist to do this for them. Reflective practice groups are slightly different, and I'll talk about this in the next slide. So what I'm suggesting is secondary interventions which can be available online. You need to have a basket of interventions which a doctor can choose from. Or let's say somebody comes to me on the corridor, stops me and says, look, I have this problem, what can I do? I can then direct them to this website where there are these various forms of self-help. Let me talk about reflective practice groups or balance groups. Now, if you look at the hierarchy that I showed a few slides back, Shapiro's wellness hierarchy, you'll find that doctors need a space to sit and reflect. We need a space to sit and talk about issues which we might not talk to our colleagues about usually. This isn't about managing a difficult case. It is about managing a difficult relationship with a patient or managing a difficult relationship with the system. It's about managing a difficult relationship with colleagues, for example. Or it might be an issue where several members of one group, the surgical team, the psychiatry department, or the university staff, for example, where they're all stressed. They need a space to sit and reflect. And these are called safe spaces. What happens in a balance group is it is a form of a reflective practice group. So at the moment, I run 3 balance groups for doctors in India, one in Bangalore, one in Talasheri, and we've just started one for the faculty in the various medical colleges, middle-level faculty for the various medical colleges in Kerala. So we've got about 10 colleges, and from the Department of Psychiatry, 2 of the faculty from each of the departments, 20 of them, come online once a week. And we're running this project to try and teach them what balance groups are. What happens in a balance group is that a group of professionals of the same level, usually maybe, so all the postgraduate trainees in psychiatry might come together, 10 of them, 12 of them, and they sit down and they talk about a case. Now, this is not a typical case discussion, but it is a discussion of what happened with this particular patient. The focus is on the doctor-patient relationship. For example, it might be that I had this difficult chap who came and he offered me a gift. And what do I do with this? I feel very uncomfortable about this particular gift because I'm not allowed to accept a gift. But there is something in the gift that the patient offered me. There's something about that relationship. Or it might be about, I felt very angry towards this patient. He was obnoxious, actually. He was shouting. Or I felt very angry towards this relative. Now, when you feel that anger, where do you talk about it? Do you go home and talk to your wife about it? Or can you have a safe space where you can discuss this? That's what a Ballant group actually offers. And my suggestion is that we need more of these Ballant type groups or reflective practice groups for doctors. One of the groups that I run for professionals in Bangalore, it is partly a reflective practice group as well. There they talk about their practice. They talk about their difficulties with the system. They talk about their difficulties with what's happening in that particular professional organization. And that helps them as well. So I'd suggest that we need these safe spaces. I'm coming to the end of my talk fairly soon. So these are some of the things that we need to pay attention to. Now, these are two posters. I said that if you have a service for doctors, you must be able to advertise them. These are two examples. Now, this is a poster that's put up in our postgraduate center in Worthing, where all doctors can know that your well-being is important and where you can access help. You need to advertise it actually to doctors. IMA Doctors for Doctors, they come up with a lovely a magazine which sort of gives examples of these, and they keep that message out in the open. Now, this is these are various things that have been brought out. Sanjay Deshpande and Suhas brought out this MBBS survival guide, and this is available from Doctors for Doctors. It's available for all prospective MBBS candidates to download and know how to survive an MBBS career. During COVID times, I think lots of departments came up with surviving COVID. This is something that was brought out in India as well. There's this lovely document called Breathe, which is again by Suhas and Sandeep. In St. John's, they have an emotional well-being peer support group for doctors. So there are initiatives that are going on in India. Or you have this in the emergency medicine department in the D.Y. Patil Medical College, where they have this a group for the emotional well-being of doctors there. In the Armed Forces Medical College, they have a doctor support guide, Physician Heal Thyself. In St. John's, again, they have a postgraduate forum. So what I'm about to suggest is that we need such fora, we need such initiatives to try and build the support for doctors. So what are primary interventions? Primary interventions are those that address things like workload management or improving teamwork. So it could be something, or it could be training, or it could be work processes. It could be Ballant groups, or it could be discussions on on-call arrangements, for example. And I think every unit, every department, every surgical team, or every other department or the university needs to do what's called a stress audit sometimes, and to look at where the sources of stress might be. It might be in the casualty. It might be in the training. Mohan just mentioned about the stress that teachers face when they could not conduct their classes because of COVID, and they had to go online and they had to teach themselves. I'm sure most of them did a good job, but they had to teach themselves. And you need interventions to help them to learn those processes. And those interventions, which are primary, which stop people from being stressed, those are the ones that work the best. Now, the primary interventions, just two examples. There's what's called the Australian Psychosocial Safety Climate Model. And they have lots of processes where they do an audit, a stress audit, and they look at where the stresses are and what the interventions that need to be. This is the GMC, or the General Medical Council. They call this document Caring for Doctors, Caring for Patients. And they think that to improve the work environment for doctors, you need to address their autonomy or control, their sense of belonging, and their competence, such as a workload, learning and training, and management and supervision. So there are several ways in which to address the primary interventions for doctors. So I'd like to sort of wrap this up by what I call a wish list, or the Stress Wellness Action Plan. What I'd like to suggest, and this is just a wish list, and I think it's worth a discussion. If you want to set up a program to address stress in doctors and other professionals, I'd say first you need a dedicated group to look at the issue and to monitor progress. You need to keep the message in the open. Like I said, you need to advertise it. You need to create narratives, have talks about this, have meetings about this, have a scientific program about stress in doctors. I'd suggest that we begin with secondary measures and have a basket of interventions, and I've given you examples of those. Ensure that the information addresses local needs, that it is accessible, available, and that it is updated. So if you have something online, make sure that that is updated periodically. I'd suggest that you create safe spaces for staff to discuss issues. So to have balance groups or reflective practice groups, and these could be staggered by experience. I'd suggest that you could use I believe in the new curriculum, you have what's called the AETCOM, the 8COM. There was some suggestion about using one session of this to run balance groups for medical students, because I think medical students is where we need to start with helping them to access help, access support, and to help another. We need to create that mindset in medical students that it is okay to ask for help if you're stressed. And we could do that by running balance groups for them or for postgraduate trainees. I would suggest that you have conflict management conferences or negotiation skills training. And finally, if you wanted, you could have a team of clinicians who will provide safe and confidential support. So just to conclude, I started by asking these questions. Are doctors stressed? And we came up with this answer, yes, they are stressed. And they are differently stressed, actually. And we understood what interventions work for them. And finally, we asked the question, where do we locate the disturbance? And I would say that we need to locate it somewhere between the individual and the system. It should not be just on the individual to manage their stress. It should not be just on the system either. It should be located somewhere in between. Thank you all for your patient hearing. I'd be happy to field any questions if there are.
Thank you, Arun, for a very, very useful lecture. And I'm sure this is a very good attempt at sensitizing all of us and inspiring us into action. I think we as the faculty and the group of trainees here would need your guidance and help to start. As you rightly said, we need initiatives in this regard, and the time is now, and we shall not waste this opportunity, because people are willing to accept and talk about work, stress, and well-being at this period of time. I'm sure the Vice Chancellor, Pro Vice Chancellor, other officers of the university will, especially Dean Student Affairs, Dean Academic, every one of us has got a stake in this. And as you rightly highlighted, it's not about the health professional. It's about the well-being of people who are getting cared by health professionals. It's hugely important. And I'm sure the Vice Chancellor will use his good officers to convince the government and the executive uh, to actually have a policy on this to enhance and make sure that well-being of health professionals is very, very fundamental to well-being of the society. Unless and until that position is taken, it will be, I'm sure, the way you presented this, it's very clear to all of us that that is the case. This is not to support a group of people called health professionals. This is about care for the society at large, well-being. It's like if I'm looking after my mother and I should have well-being and I should have the capacity to care, to sustain care. So I think I'm sure the paper is now open for discussion, and I think I'm sure Arun will agree that uh, the purpose of this opportunity is to encourage people to bring out their opinion on this, and then I'm sure that we are all looking forward to some concrete action in the near future in terms of initiatives. From our side, all the three deans and will be very happy. I'm sure this talk is music to the ears of the associate professor in charge of health humanities and as well as young adults. I'm sure Dr. Iqbal also will be very happy to listen to this. Let us see what others can see. Sandhya, can you look at the chat box? There are
Yeah, sure, sir. Yes, sir.
first chat box and then we will open up for discussion. I'm sure after the chat box is quickly answered, we will ask BC and other people about their comments.
Okay,
Is that
sir.
okay?
Yeah, yes, sir. Perfect, sir. So there's a question in the chat box. How can we measure our stress? Is there any scale to measure?
Yes, of course, there are several scales. And one of the scales that I showed here is called the Perceived Stress Scale, the PSS. That's the one that you answered, the 10 questions. And that's the most common scale. Now, there are also scales to measure burnout, for example. There are scales to measure compassion fatigue. There are scales to measure things like resilience as well. So what you might find is that several of these scales are available, and you can use any one of these to actually measure your stress. I'd be happy to share this with anyone who wanted. You have my email, and I'm happy to send it to you personally if you'd like to.
Thank you, sir. So then we have a suggestion. Self-help group is a wonderful innovation. It's good if the University of or Psychiatry Society can come forward in setting up this measure for the benefit of the employees.
Yes, thank you. And I'm glad that somebody's taken that up. And I'm sure Mohan, Shaji, and the others will come up with something.
So there's another question. Please suggest us some interventions to prevent stress in our student life.
Stress in us during?
Sir, please suggest us some interventions to prevent stress in our student life.
In student life, oh gosh, there's a whole basket of interventions now. I wouldn't want to spend the time talking about just stress management here, but I'm happy to communicate with anybody who'd like to sort of, talk about this. I suggest that you get in touch with me or with Shaji or one of the others, and we can talk about what those stress management techniques are. I did suggest a few when I spoke about the basket of interventions. If you look at each one of those, I think if you're able to learn those and to have sessions on them, that would help you with managing stress.
Thank you, sir. So another question is, can you please say stress management of others?
How do you manage stress in others?
Yes.
I
Yes.
think the most important issue there is to recognize if somebody else is stressed and to be able to actually talk to them. So what I would suggest is if you have a personal relationship with that individual, don't hesitate to go up and ask them if they are stressed, because very often people don't talk about their stress. And I think the ability to talk to somebody is a first intervention to manage other people's stress. And then there are, of course, techniques that you could suggest to them later. But that relationship, that ability, somebody just asking me, are you stressed now? I think is a big relief that somebody has actually recognized it.
Thank you, sir. Another question is, how do we recognize if we are having a burnout?
There's a burnout scale if you actually want to measure it and recognize it. But those three characteristics, which is emotional exhaustion, if you're feeling very tired, emotionally exhausted, unable to actually feel for others, that's one of the signs. The second is, it's called depersonalization. That's not very common. Depersonalization actually means you have a feeling of unreality about everything that's going on around you. When you come into work, you sort of feel, I should not be here. I don't sort of recognize this place. And the third bit is that you feel a sense of lack of personal achievement. You feel as though you haven't achieved anything professionally. If those three things are troubling you recurrently, then it might be that you're facing burnout. Might be.
Thank you, sir. So another question is, are there any mechanisms in Indian institutions which can be taken as models to emulate?
I suggested a few here. Look, what I would like to suggest is, look, there are several interventions for stress, for individual stress, for stress in teams, and for stress in systems. And there are several such interventions. I think each team or each department or each group actually needs to choose from this, because there is no one size fits all. What you need to do is to tailor those and to take those that will help your particular team. So there isn't one size, but there are several good examples. So for example, what they did in the D.Y. Patil Medical College, I think was very, very unique and useful. What they're doing in St. John's in Bangalore is very useful. What was done in Kerala during the COVID times is very useful, I think. So there have been interventions you can look at.
Thank you, sir. The next question is, what type of meditation is helpful to manage stress?
Meditation, I think.
Yes.
Okay. Look, the one which is the mantra for now is mindfulness. Okay, and mindfulness is it's touted as being useful for all sorts of conditions. But there is a lot of data which shows that mindfulness practice is useful in some conditions. For example, in the UK, it is recommended for recurrent depression, for example. Mindfulness practice is recommended. Mindfulness-based cognitive behavior therapy is recommended in the UK for certain types of anxiety and for depression. So if you're looking for one which has evidence, it is mindfulness. But look, any type of meditation I would suggest is useful. Some people try Vipassana, some people have, for example, the dhyanas. They're very useful, I think. But what suits you? I think some people that I see say that I can't sit down and meditate. And that's perfectly understandable. And you know what? There are types of meditation or mindfulness that you could practice when you're walking. There are types of mindfulness or meditation that you could practice when you're doing Tai Chi or Pilates or exercising or running. So what I'd suggest is look at that particular practice as to what suits you and adapt it to your needs.
Thank you, sir. The next question is whether guided imagination helps to reduce stress.
Yes, there is evidence from various. Look, the current buzzword in mental health and psychiatry is what is called mentalization. And mentalization is a form of treatment which is used to teach people to mentalize their problems rather than emotionalize it, is to imagine their problems and to come up with solutions for it. It is a form of guided imagery in a way. So yes, the answer to that question is yes, guided imagery could help you, especially if you're used to it.
So the next question is, what are the measures that can take to reduce stress in hostel settings?
I didn't know that hostels were stressful. I thought hostels were places of fun. I really don't know what to say to that particular question. I'd say if you can have fun in a hostel, then there's nothing more than that. We still remember the great times we had for example, in Bangladesh hostel in Alleppey, and in third and fourth and second block and first block in Kozhikode. Those are great times. So I really don't know how to answer that question. I'm sorry.
So how many questions are there now?
One more last question, sir.
Yeah, after that we'll open up for discussion.
Okay, sir. So when we are stressful, how do we feel physically and mentally?
I think that's a very, very important question. Very often we imagine that stress is a thing of the mind. It isn't. And I think don't separate the body and the mind. Listen to your body. And I'd say this is very important because what is well known is that sleep, your diet, your activity, and your energy levels, all of these play into how your mind functions. Now, there was a study which showed that if interns in the US worked for about 24 hours, the chances of them making a stick injury or a needle prick injury increased by something like 160%. The chances of them having a road traffic accident increased by something like 300%. And the chances of them going on to make a medical error increased by something like 450%. This is just sleep deprivation, just sleep deprivation. So if you can't sleep and if you don't have a regular diet, then when I say a regular diet, it might just mean 2 meals a day. A lot of people forget to eat. So if you don't get enough sleep and you don't have a regular diet, it affects your concentration, it affects your energy levels, and it affects your ability to function. One of the interventions that we did, a very simple intervention that we did for our postgraduate trainees in Worthing here in the UK, was we provided them, the person who was on call, the next morning, they got what is called a hot breakfast. It was waiting for them in their room. It didn't cost the department anything. All of us consultants pitched in, it was about £5 a month, which is nothing. And that gave the trainee a hot meal actually 3 times a day. So they got lunch and they got dinner, and they didn't have to pay for it. Nothing works like good food. And that was a stress intervention, I think. So to the question about somebody who asked me how to reduce stress in hostels, provide yourselves with good food.
I think there is.
Thank you, sir.
Okay. Last question about Rachel about nursing students or something like that. I think that will be the last one.
Okay, sir.
Just read that aloud.
So there's a question, which are the most useful intervention to reduce stress among elderly?
Wait, I think Shaji is much better positioned to answer this question than I am. So I would defer that to Shaji.
Okay, thank you, Arun. I think that is a general question, and there were general questions, and I think well-being is related to everyone around you, whether it is an older person or a younger person. And I think thanks, Arun, for giving that focus on well-being. I think it is hugely important that we foster well-being to begin with, and be mindful of sub-threshold problems of larger magnitude, so that we will prevent many of them going on to develop burnout and severe problems. So that would be a good idea. I think this is the message I got, that health professionals should, or the systems which train health professionals, should focus on well-being of health professionals, so that they learn how to foster well-being of others. And by fostering well-being, you will be reducing the prospect of negative impact of stress. The incidence of burnout will come down, and major negative outcomes also will decrease. I fully agree with you in saying, in your position, that to identify and treat bad or negative outcomes at a later stage may be much more difficult, and you will only end up spending more energy and time on few people. But then in that bargain, you will miss out on people with mild to moderate issues. And everybody will have to come to a threshold of being clinically significant in having symptoms, so that you get some kind of attention. I think you are very right in saying that we shall focus on well-being and focus on primary prevention. I think that's great. So I would request now the officers.
Shaji,
Yes,
could I just say one thing which I've,
please.
and I must beg your pardon for not having mentioned this. I mean, this is so important, and how could I have ever forgotten this? What I'd like everybody to know is that the IMA, the Indian Medical Association, and the Indian Psychiatric Society have actually come together to look at what support doctors need. You know that the IMA has got the Doctors for Doctors, the D4D, and Nilima Kadambi, who's the chairperson of that. She and the president of the Indian Psychiatric Society, I think they've signed up to coming out with some interventions. So there's some work going on. And what I'd like to ask all of you who are here is that if you're keen to sort of join in that venture, please get in touch. Please get in touch. It's a wonderful opportunity. I think this is the right time to actually start trying to see how we could support doctors individually or as groups.
Thanks, Arun. I would request Professor. I can see Matthew Verghese joining there. Professor Mohan, Honorable Vice Chancellor, PVC, do you have? Please make comments if you are there. I can see Matthew Verghese. Can you see Arun?
Yes. Yes.
Matthew, can you unmute? And let me take this opportunity to. Matthew, are you there? Are you listening? I think he
very
Matthew,
much,
can you...
very much.
Thanks,
Listening
Matthew,
very
for
much,
being with
and
us.
thanks to Arun. I have nothing else to add. After Arun has spoken, I have nothing else to add. So, thanks, Arun.
On behalf of the university, may I request your support for this venture, which we might then talk to you and keep you in the loop.
Absolutely.
Matthew. Thank you, Matthew.
Absolutely, no problem at all.
Okay. Professor Mohan, Vice Chancellor. Hello.
Yeah.
Yes, please.
Thank you, Shaji.
I just wanted you to know that Professor Matthew Varghese, who headed the department at NIMHANS, is also there. He has offered help in any venture which KUHS might want to initiate in the near future. Over to you, sir.
Thank you. Thank you so much. In fact, we need a lot of help. I don't know, it's a wonderful talk, as usual, of course. In fact, university was actually concentrating on students only. We have a flagship program called SSGP, Student Support and Guidance Program, which is quite active in almost all institutions. And we have 1 or 2 nodal officers appointed and trained by the university, and they look after the stress of the students. And this SSGP council, they are called SSGP counselors, and we have district level meeting of these SSGP counselors. And if there are problems, these are discussed, and we have consultants for that. So this is running very smoothly, and I can say that in spite of being a large university with 1 lakh students, we did not have much the fatalities, suicides, and all these things were very reasonably prevented. But now this COVID has created a lot of problem. We could not meet frequently, but still the system is working. But then we have forgotten our faculty. We don't have any program for our faculty, and that is what you have stressed in a very big way. The doctors, the faculty, the employees. In fact, COVID made us realize that they are also facing a lot of stress. In fact, all of us are having stress, but as you rightly said, we will not divulge our stress. Because how can a doctor be sick? Like kurundottikku varam varilla ennu nammal parayarundallo. So therefore we were hiding our stress, and that's why you rightly said that only 25% of us said that we have stress, when probably in UK people are more honest and they said that 67% are having stress. Probably that may be also not understatement. That may be maybe 80, 90. I think that if you are a professional, a medical practitioner, you will definitely be stressed 100%. But then you may have a mechanism to get out of it, probably. That may be. So we think that, in fact, when I see a patient, and that creates me a lot of problem, but then I will manage some kind of mechanism, and I think that I have de-stressed myself by my own techniques. I don't know, these are correct way when I am speaking to a great psychiatrist, but then these are realities. But the point is, we should have a regular mechanism to interact with our doctors, our health professionals, and and the technique you have said, and which you have been heading, is wonderful thing, so that you can have, we can have a small groups who can interact. And I think we will create a model. Definitely we will have to create a model. We will have to have a plan, and then we will implement in all our institutions. That's what I'm offering. And since we have got as Dean of Research, the great psychiatrist with us, so then that will be easy for us to implement. And so we will make sure that this will be implemented in every institution. So I request your help to create a model, so how it will have to be done, and then how it can be monitored, and how we can document all these things. And probably we can create some document for future also, because Kerala is unique in various counts. So that uniqueness of Kerala can be shown in looking after their doctors also, so that they will be able to look after their patients better. That will be the final thing. As you said, a doctor who does not sleep a day creates a lot of mistakes. And now I'm shocked. I must have created a lot of mistakes when I did not sleep during my house residency period. I did not sleep during my PG period, and most of us must have done that. So maybe we can, if we have real data, we can say that no doctor should take duty more than 12 hours. 24-hour duty is a practice now. It is even done now. Even now, it is done. We have taken 24-hour, 36-hour duty, and we used to say that we are great people. We have done 36-hour duty. What greatness? You must have killed few people. I don't know. So these are realities. So I think definitely what you have opened our eyes, and we will definitely do it. Let us create a format, platform, and it will be implemented in Health University. That's what I can give. Definitely. Thank you.
Great
Thank you,
words.
sir. I'm sure this will be taken up and then taken forward. Varghese Punus had sent a message that Indian Association of Social Psychiatry has some initiative in this. Thanks. Professor Varghese, you want to say something? Varghese Punus?
Yeah, good evening, all of you. I'm very extremely delighted to and maybe even excited to say to hear from Dr. Arun Kishore for since long time. Just to add on, the Indian Association of Social Psychiatry has taken the stress among trainees, students and trainees in a big way, and we are trying to chart out a program to cater to the wellness of the students in a positive, in a positive way, like most of the aspects Dr. Arun described in his talk is being included in this program. I was just wondering whether university, IMA, IPS and Indian Association of Social Psychiatry and professional associations can work together to evolve a model where we can implement these things in a more effective manner. That's all. Thank you.
Thank you, Varghese. May I request Professor C.P. Vijayan sir or registrar or make some comments? Vijayan sir?
Yes, as described by Professor Arun Kishore and mentioned by our Honorable Vice Chancellor, Professor Varghese Punus, yes, doctors are a group where the stress at workplace is maximum. When they are working for a prolonged time, when they are dealing with life and death situations, all these things give them a lot of stress. And I think we should have an organized work to reduce stress in the working atmosphere for doctors. And this was definitely an eye opener, and we should do something for the doctors that will reflect on our patients and society. Thank you.
Thank you, sir. Registrar, sir, Dr. Manoj.
Professor Krishnan is there.
Professor Krishnan, sir.
Yeah.
I saw him.
Thank you. Thank you, Arun. It was a very illuminating talk. I just have a question. Why is it called the Ballant Group? Was there any specific reason?
Michael Ballant was the person who started it, and hence it is known by his name. He started it for GPs, general practitioners, in the UK, and it's very popular amongst the GPs. They still have their weekly Ballant groups. It's a part of training in psychiatry. It's a part of training amongst most medical students as well in the UK.
Thank you, Arun. Your talk took me back to the days when I used to carry a cardiac arrest bleep in the UK from Friday morning till Monday morning, non-stop. Going to the toilet, everything was difficult, stressful. I can understand. They've changed the rules regarding duties in the UK much later, after some anesthetist committed suicide. I mean, he rammed himself into a wall driving back from work. He slept on the wheel and things like that. I'm sure the university would be able to set up Ballant groups here, and that will help not only students but also staff. Many of us who labor under great stress, under normal and abnormal situations. You remember, Mohan, we went for an inquiry after a certain exam. I'm sure you'll remember the days.
Yeah.
Could I just
Dr.
add,
Madhavan is there? Dr. Madhavan.
Mohan, could I just respond to Krishnan sir? So you're right in saying that in the UK, we have what is called the European Working Time Directives. And what that states is, and this is not just for doctors, that no person will work for more than 40 hours a week. So if you come into the UK or Europe and you get into a bus, let's say you hire a bus, the driver will drive for 8 hours and he will stop, irrespective of where you are. He will not drive beyond that. And that's because they know that if they drive beyond that there will be accidents.
Yeah,
They drive into the night.
You know, we needn't go that far, but we should do something about it. And it's about time. Your talk certainly has highlighted this in a big way. Thank you very much, Arun.
Thank you, sir.
Dr. Madhavan is there?
Yeah.
PM. Yes.
Thank you. Arun, as usual, class. As far as I know, you're one of the authorities, maybe in Southeast Asia, even maybe more. What I would suggest is we've been talking big as usual, but with Professor Mohan and Professor Shaji and all that, let's first start with Thrissur. We have Arun's guidance with us, and maybe as we imbibe more and more, we kind of spread more and more. I think instead of getting into half a dozen organizations, and you know what happens in India, nothing works. So my request is that we basically start something in Thrissur, or maybe whatever Professor Mohan, Vice Chancellor, wants to call it, and then be a model here and then spread that would be my suggestion. Anyway, thank you for giving me this time.
Thanks, Mother. It's always a pleasure to listen to you. Is the registrar or C, Dr. Anil, do you want to say anything? Dr. Iqbal? Anybody wanting to make any comment? I think we have decided to wind up in another 5 or 10 minutes. That is the schedule. I'm sure the Center for History of Medicine and Health Humanities, as well as Center for Young Adults, will be very happy about this session, because probably they could also take leadership in finding out what are the needs of both faculty and trainees, and how a certain institution or a region, as Dr. Madhavan had said, could initiate a kind of intervention or plan, and then we can see how it works. Sandhya, are you there?
Yes, sir. I'm here. We are here, sir.
Yeah. So what is the plan? If there are any questions from the floor, they could, if there are none, then you could,
So we have
you
covered
could have
almost all,
comments. Yeah.
we have covered almost all the questions, sir.
Yeah.
Yeah.
I think is that Vice Chancellor, sir, Professor Mohan?
Yeah.
Then plan of winding up your final comments, and then Sandhya could propose the formal vote of thanks. I don't think registrar was there.
I think, yeah.
Yeah, he must be busy otherwise. Your final comments, and then we will ask Sandhya to propose vote of thanks.
Correct. So thank you, Arun, and thank you all the participants of this wonderful webinar. We had to begin with, we had an excellent participation and good discussion also, and it has given clear ideas and guidelines for us to follow up, and it will be followed up as I said earlier. So we will have these Valentine groups, and we will have some measures to see that our faculty, our doctors, our health professionals, they will be having a good life with less stress, and their wellness will be taken care, and that is the responsibility of the university also. As we say that if the doctors are good, then the patients will be taken care. Similarly, if the teachers are good, students will be taken care. So that is also important. So we will do that. And thank you, Arun, once again, and thank you all the participants.
So over to you, Sandhya, to propose vote of thanks. Thanks, Arun. We look forward to your help. I'm sure we can enlist the help of Matthew. Sandeep Grover, I sent a message to him. So we will see what we can do. Sandhya, over to you now.
Thank you so much, sir. I take this privilege to deliver the vote of thanks. I express my deep sense of gratitude and sincere thanks to our Honorable Vice Chancellor, Professor Dr. Mohan Kundamal, sir, for inaugurating the program. I, on behalf of both the centers, profoundly thank you, sir, for giving us the opportunity to conduct this webinar. Thank you so much, sir. I extend my privilege to thank our Pro Vice Chancellor, Professor Dr. Vijayan, sir, for providing us all the insight and expertise that helped us in conducting this program in a very smooth way. Thank you so much, sir. My heartfelt gratitude to our Registrar, Professor Dr. Manoj Kumar, sir, for all the help rendered. Thank you, sir. I consider myself extremely humble to express my sincere thanks to eminent and dignified speaker, Dr. Arun Kishore, sir. Your talk was extremely informative and has enlightened our mind and has shown us a new path. On behalf of both the centers and Kerala University of Health Sciences, thank you profoundly for the wonderful talk you have given to us. Thank you so much, sir. I take this opportunity to thank our Dean Research, Professor Dr. Shaji, sir, who has inspired us to conduct this program and has given us a very eminent resource person. Thank you so much, sir. Heartfelt thank you to you, sir, from both of us and from the university side. Thank you so much. I convey my sincere thanks to Dr. Anil Kumar, sir, Controller of Examination, and Dr. Iqbal, sir, Dean Students Affairs, for all the help rendered. Thank you so much, sir. I'm extremely thankful to our systems manager, Mr. Harilal, sir, and team, Joint Registrar, Mrs. Geetha, ma'am, and team for all the support rendered. Last but not the least, I thank all the distinguished and dignified participants for actively participating in this webinar and making this program a very lively, active, and a successful one. Thank you so much. Once again, me on behalf of both the centers and Kerala University of Health Sciences, thank each one of you for your kind participation and cooperation. Thank you so much. Have a great evening and good night. Thank you so much, sir.
Thank you, Sandhya, and thank you, Anup. You were very persistent, and thank you for arranging this. And I think this was a great, last 2 hours were indeed very great. Arun at his best, and both of you doing good work.
Thank you, sir. We are very honored to hear, sir. Thank you so much.
So thank you. Good night.
Good night, sir.
Thank you all. Thanks, Arun.
Bye. Bye. Bye, Mohan. Madhav.
Thank you, sir.
Sandhya.
It was great meeting you, sir. It was real. We are really humble, sir. Thank you so much.
Thank you, sir. Thank you, sir.
Thank you. Your voice is.
Yes, sir.
Get well. Get well.
Thank you, Arun. Yeah, bye.
Bye.
We'll catch up.
Yeah.
Bye bye.
Dr. Arun, this is Dr. Vengamma. You remember me?
Vengamma, yes, she had been sending
From
the
Nimans.
message. I don't. Vengamma was there all throughout the session.
To say I'm seeing you after almost maybe 3 decades. Nice to see you. Nice your talk.
Gosh, Vengamma.
You remember me at least?
Of course, என்னங்க? Of course I do. Of course I do.
Yeah, we remember all those demands. This.
Yes, where are you now, Vengamma?
I'm at Tirupati.
Really? Oh, gosh.
Please send your email. This one. I just wanted it.
I will send it to you in the chat now, Vengamma.
Yeah.
Vengamma was Vice Chancellor at Sri Venkateswara University.
Oh, really?
Yeah, for the last 7 years.
Priyavare,
But anyway, I saw your this one. I thought after so long, I remembered your name. Then I joined.
Oh, thank you for that.
So we have
Just
very
then-
eminent people joining from all over the country.
Yeah, yeah. It's nice program.
Thank you, Dr. Vengama. It's a pleasure to have you.
Yeah.
Ah. അതിനൊരു പുതിയ ഫോൺ വേണം. തീർച്ചയായും.
Matthew, good to see you here, Matthew. Matthew is also a part of the IMA IPS. I mean, I think both the others, Suhas and Sandeep, they were both here, I think.
I'll speak to Sandeep.
I saw Sandeep.
Yeah.
I saw Sandeep and I saw Suhas, I think.
Yes, yes. Because like I told you, Shaji, we're a small group.
I will take this forward.
Think of those.
Okay.
Okay. Sandhya,
Bye-bye.
you there?
Okay.
Bye.
We are trying to
Bye
mute. We are mute.
Okay.
Anjali Ammu, kindly mute your mic, please.
Arun, you could send that email ID to Vengama.
I sent it.
Yeah, okay.
I've sent it.
Yeah, yeah, I took it. Thank you.
And those who want the slides, if there are, if they send us mail, then
Yeah.
Sandhya will manage that. Okay.
Yes, sir. I'll take care of it.
Okay, then.
Okay.
Shall we then call
Thank
it
you.
a day?
Thank you. Yeah. Bye then.
Okay. Sandhya, over to you now.
The present meeting, everybody are all the eminent and dignified personalities we could see, and it was really a pleasure hearing all the innovative talks from everybody's side. So it was really a wonderful session. We really, we feel highly privileged. Thank
We
you.
will do a review of the program maybe Monday.
Sure,
Okay.
sir. Pleasure.
Okay, then we can wind up.
Yes, sir. Yes, sir.
Okay.
Thank you. Good evening and good night to everybody.
Okay.
Thank you.